You are watching the Doctalk show.
To date, Uganda has had 55 cases of the coronavirus and none has died. That's excellent news. It means we haven't lost anyone yet to this dreaded disease. But people may be curious, how is the ministry treating these people in the hospitals? You know, are we using particular drugs? There are all sorts of stories about what sorts of drugs treat coronavirus. Well, who better else to tell us what happens in reality than the Director General himself? So, Dr. Movesa, what exactly is going on in the corona treatment centers? How are you managing and treating people? And how many people have recovered?
Thank you very much. First of all, we have 55 cases, as I told you about. They are being treated in 4 different places.
Okay.
In Entebbe Hospital, in Mulago, we had a case in Hoima, and a case in Ajamani. So far, we have treated and discharged 22 cases.
And when someone is discharged, what does it mean? When can you say this person who had corona can go home now?
Yes, after 2 weeks of treatment, which I'll be explaining what we've been doing, we do 2 tests, repeat tests, which my colleague was talking about. If you get a negative test, then we put an interval of another 24 hours, and then we do another repeat test. If you have 2 negative tests 24 hours apart after 14 days, and you don't show any signs and symptoms, and your tests are negative, then you are good to go, and we discharge that patient. Because the process of discharge is a bit different. You have to prepare the home where you are going. We have to give you some information.
Okay.
But on top of that, we also have to go to visit you every day for the next 2 weeks. But your question, I digressed a bit. Your question was, what are we doing for those patients?
What are we doing?
Most of those patients, as you know, it is a virus disease. And as of now, there's no concrete cure for killing that particular coronavirus. So we are doing symptomatic treatment. We support the patient, fluids, painkillers. If there is a temperature, we give tablets like Panadol, which will reduce the temperature. And then we have also been giving ascorbic acid, as it has been seen.
I think that is vitamin C.
Vitamin C.
But we have lots of vitamin C in
We have lots of them in the market.
All the fruits we eat,
eat.
those are vitamins.
Yes. Okay. So generally, that's the protocol.
That has been the main
using.
treatment.
But also we treat if there are other diseases which the person has. Like a number of them who were in Mulago had other diseases, like diabetes, they had hypertension, and we also treat concomitant diseases as well.
Okay, so you treat the patient as a whole. You don't only focus on the corona.
On the corona.
But you treat everything else.
Exactly.
All right, that's very interesting. So, Dr. Idru, talking about treatments and cure, people are curious. We have been saying there's no cure for corona, but then they are seeing people who are recovering. So now they are confused. How do people recover, yet we say there's no cure for corona? How does that happen?
So our bodies are designed in such a way that when a foreign object, a germ, enters the body,
like that coronavirus.
For example, the coronavirus.
When it enters the body.
So the body recognizes it. We have the white blood cells and other cells in the body which fight germs, which fight foreign objects, any germ, whether bacteria, whether a parasite like malaria, or a virus like corona. The body tends to recognize these things and know that this is an intruder. And this intruder should not be in our system.
So that's the immune system.
The immune system, our immune system recognizes it and puts an arsenal to play. And these arsenals include some cells which actively comes, gets these intruders and kills them, or they produce antibodies. And these antibodies coat the arsenal, limit its movement, restricts its movement. It's like you grab and and then you have these cells which come and kill them.
So in other words, the immune system of the body kills
these viruses. Okay. So over the course of the period, the person initially, the first few days, the body will not have recognized or will have not built enough immune response to develop and restrict or kill this object. And it may take a few days before the body puts this together. And So you start feeling unwell, you may have the cough, you may have the sore throat, and you may develop eventually the difficulty in breathing. But when the body organizes itself, and then it's able to
like
put
a
up
war,
a fight.
because
Yeah, it's a
it has
real
known the
war.
enemy,
Yes,
and it's ready to
yes,
start.
yes. A real war within your body. Then it moves, it controls it, and at the end, it defeats the virus. Now, if a situation arises where your body's immunity fails to kill the virus can really throw you down, or it may even kill you. But
So I guess we should now talk more about, we'll come to talk about how we can improve our immune systems, because everything appears to be depending on how good one's immune system is, how good the body's defenses are. But we'll visit that in a short while. So I think now back to you, Dr. Mwevesa. There are some stories, there are some rumors that drugs like chloroquine, chloroquine was an old drug used to treat malaria. There are rumors that it can cure coronavirus. Is this true?
Of course, there are studies which were going on, but many of those studies have not been conclusive, have not been verified, and it's really not confirmed that chloroquine can help. So at this juncture, you have helped me. I want also to advise the general public, because I know people have been rushing to the supermarkets to buy chloroquine.
Or haven't they finished all the chloroquine?
They may have finished it even in the market, because I'm told it started at 20,000, went to 200,000. I'm told it is over 300,000. It's not really confirmed. There are no studies which have confirmed it.
And the people in Mulago, in the treatment centers, were using chloroquine.
We are not using chloroquine either. Yeah.
So
I would advise the public not, first of all, to stop treating themselves, because people may be getting a slight flu, may be getting a slight fever, and start swallowing chloroquine. So that one is not yet confirmed, and it's not a treatment guideline as far as the ministry is concerned here.
And even to put this further in perspective, many of these people have been taking the chloroquine that it will prevent either COVID or it will prevent the complications of COVID. Really, there's no evidence that it does.
There's
in
no
any
basis.
case, there's no
scientific basis.
Chloroquine does not prevent you from getting COVID disease.
But when you talk about things like scientific basis, the layman won't understand what exactly that means. What do you mean by a scientific basis?
Okay, so in medicine, what we usually do is, if a disease appears, we test drugs. We test the different drugs and see its response. One on the germ, if I put it in a test tube or in this cup and I add that medicine there, and we check under a microscope, does it kill it? Okay. That's the first stage. If it kills it, then if I put it in an animal and I give this, will this animal improve?
So like the animal falls
First,
sick,
yes,
and then you give
that
drug.
medicine.
Okay.
And does it improve? Now, if it can do that and it does it safely in that animal, then we give it. For the human beings who are fallen sick, we give that medicine. And we compare to those who did not get it. Was there really any difference? And
like the people who didn't get, did they survive better than those who got? So that is the scientific basis.
That is the scientific basis. And to date, there is really no evidence that people who have been given chloroquine and those who have not been given, there is any change. And it will appear that one, chloroquine does not prevent you from, definitely does not prevent you from developing the disease if you have the virus, and it also appears that it does not improve the outcome. So for that,
and that's on top of having more side effects than someone who has not got it. Yeah. So here the point is, chloroquine at the moment is not standard treatment for coronavirus. So do not bother buying yourself chloroquine. Just go to the market and buy yourself fruits and vegetables, and your body's immunity will take care of the rest. So coming after the break, we'll talk about a bit more further details on coronavirus and what we should be doing, reflecting more on the prevention strategies and so forth. Don't go away, we'll be right back. Remember, you're watching the Doctalk show. If you have any questions regarding coronavirus, send them on our social media platforms, on Facebook, on Twitter. We'll be so happy to answer your questions. Please stay tuned.
You are watching the Doctalk show.